underlying causes have been treated, we all have one same issue, and that's coverage. So conventional therapies, although they are very important and essential, they lack the personalization that these ulcers need to be treated. They usually need several follow-up checkups. Usually these patients have very difficult pain management, and they take very long healing times. So that's where regenerative medicine has been a promising research and development field. So the objective of our work was to evaluate the early safety and efficacy of 3D bioprinted autologous micronized adipose tissue grafts for the regeneration of these complex chronic lower extremity ulcers in a single Chilean center. So we did a retrospective descriptive study. It's only on adults with complex ulcers in the Brica Hospital from March 2024 to March 2025. This is how we do it. First, we do a minor liposuction. This was performed by a plastic surgeon from our surgery service. Then what we obtained goes through a mechanical micronization process with 4 different sizes of filters. And what we obtained after that is mixed with thrombin, which permits to have the consistency of a bioink. We use then the 3D bioprint of Dr. In Vivo by Rocky. And we, with using artificial intelligence, we do a custom graft for the patient's wound. We do surgical debridement as usual, and then a direct application of the graft covered by paraffin gauze, and then secondary dressings. The follow-up protocol is very standardized, but what I want to emphasize here is that after the procedure, during the first 4 weeks, we get to have weekly changes of primary and secondary dressings, which allows us to have an outpatient management with fewer checkups of these patients. We have already treated 13 patients with a median of 70 years old. 12 of these patients were men. And what I want to highlight here is that 12 of these 13 patients had PID, and they were revascularized previous to the graft application. The ulcer characteristics, some of them, 4 patients had more than 1 ulcer, 3 of them were bilateral. The median initial longer diameter was 7 centimeters, and 10 patients had a deep involvement, 7 of which had bone or joint exposure. What we wanted to evaluate, since this is our first approximation to this technique, was the efficacy and safety of this, mainly the safety. And all patients had a favorable progression of the ulcer. All of them had maximum diameter reduction. And what is very important for us, they all had an important reduction of pain. 10 patients had complete healing during the follow-up period with a median time of 98 days. And there were no serious graft-related adverse events. Here you can see some examples on the top from day 0 to week 8. Then in the middle from day 0 to week 15, and at the bottom, day 0 and week 12. Our conclusions with this is that this is a safe procedure for these complex patients. Mainly, this helps a lot with pain improvement, even in patients that are they don't have an option to be revascularized. This does improve pain. All the patients have a favorable progression of the treated ulcer, and it's a way to personalize this technology. We think that there is a reproducible protocol, and we hope to do a prospective study and keep treating our patients with this, hopefully in a multi-center way. Thank you very much.
Excellent. Just for you to know, the next session will be entirely dedicated to regenerative medicine. And can you tell us about the cost?
Yeah, it's about $2,000, the cost. With artificial intelligence, we take a picture, and that tells us how many kits, because they sell it in a kit. So usually we use one, and one kit is about $2,000.
One per patient.
Yeah, or at least a big ulcer. You need to treat a patient that has bilateral. You maybe need to
two kids.
Yeah,
And that was the price.
that was the price.
Interesting. And you showed how long it takes to heal the ulcer comparing to non-bioprinted limited
The thing is that
dresses.
the patients that we've tried this are patients that had more than 1 month and no progress. And with this, after a month, we did notice progress.
After 1 month.
After 1 month, you do notice the difference.
And
There are patients though, that we had one patient that initially went well, but it had a progression of their arterial disease and needed to be treated again. And had another ulcer, but the ulcer that was treated with the Viagra did okay.
Great job.
Thank you.
Questions for the audience?
You guys have the chance to characterize the micronized administration. Do you see any differences in regards to patient age, patients who do smoke and do not smoke?
Yes, we had a little time here and we have so little patients that we don't compare them too much. But yes, we do. Usually most of them had arterial disease. That's like the most common thing.